We need to know our margins, but they shouldn't define our value. What should define our value is the impact we're having in our communities and in the lives that we're touching. It goes to a leader redefining what sits at the top of your dashboard. Is it just your gross margin? Is it just your census? Or is it these really outcome data points? Like looking at that. You still have to track the health of your business, but looking at maybe stability and continuity of care versus just how many hours of service you delivered. Maybe looking at the satisfaction of your employees versus how many employees do you have.
You're listening to Home Care Hindsight, the podcast where we talk with home care leaders about the big mistakes they've made and the even bigger lessons they've learned along the way. I'm David Knack, head of sales here at Zingage, and I've built a career on the idea that we learn a whole lot more from our mistakes than from our successes, which is great because I've made a lot of mistakes. I've gotten to know some of the leaders in this industry who've built amazing businesses and are super well respected. So I thought it'd be fun, instead of asking them about the great things they've accomplished, to have them tell the story of one of the biggest mistakes that they've made and how that mistake changed their thinking and the way they run their business. All right, welcome back to another episode of Home Care Hindsight, brought to you by Zingage. I'm joined today by Sara Wilson, who's CEO and president of Home Assist Health. Sara, thanks for joining the show.
Thanks for having me.
So, Sara, we've seen each other a lot over the last couple of years, and I know everybody's got a story of how they got into home care, but interestingly, we actually haven't had this conversation before. So how'd you get into home care?
I was actually raised in the industry growing up from my earliest childhood years. My parents were both in disability services. My mother primarily on senior care, my father on intellectual disability, developmental disability space. And early 1980s, my dad was working in a leadership role at the Department of Economic Security, Division of Developmental Disabilities, and was a partner in the state and to develop the Medicaid waiver. And he'd been working for about 2 years to try to get vendors to respond to the RFP to become home care agencies, and nobody was going for it. So they decided to be one of the first home care agencies under this waiver in the state of Arizona in 1990. And so I remember those Friday nights sealing envelopes on our living room floor, watching Star Trek and eating popcorn and having a staff throughout our office. I'd come home from school and they'd be working and we traveled throughout Arizona to remodel group homes, day programs, and just their organization grew. I remember going to Disneyland and they would have to take business calls while we waited in line. And it was just part of our everyday normal. Fast forward, I went to college at ASU and had different pursuits for myself. I wanted to follow a more traditional corporate America world, 9 to 5. And I did that for about 3 years and honestly felt like I was a cog in a wheel. I didn't love what I was doing. I didn't feel like my work was making a true difference, the way I saw my parents' work have a true impact. And so I had an opportunity to join a CMS New Freedom Initiative grant in around about 2003. And I did it. I was a project manager. At the time, I was working under Melissa Harris, who's still at CMS. Got to see her not too long ago in DC, and fell in love with home care on a professional level, and had the opportunity to start up different home care agencies that were in that. It was a self-determination grant project, helping people with disabilities form and run their own agencies. And one of those took off and I was the president CEO. And then that evolved into where I'm at now at Home Assist Health, where I was brought on to take over the home care program that was under our safety net hospital system and separate it out to be a separate, distinct nonprofit, expand the contracts. And I've been here ever since. So professionally, I've been in the industry for 20 years. Personally, I've been in it much longer.
Yeah, you came by it honest. What was your original career track? Because it's in corporate America, but what kind of work were you hoping to do?
In college, I got accepted back in for my master's program, and I was pursuing communication, human communication, organizational comm. Really loved nonverbal communication and its role in the courts. Had some interest in law. very different, got a job offer in a public relations firm. And I had clients like Arizona Department of Health, anti-tobacco education prevention, all these really great programs. And I think the good thing that came out of my time in public relations is where I met my husband, and he's a marketing expert. So that's where I've been. I spent 3 of my years, and that's where I met my husband.
You said something that was particularly nerdy, and I want to kind of double click into, which is the role of nonverbal communication in the courts.
So there's actual jobs where you can be a trial consultant and you work with legal professionals on how to identify good jurors and how to be a good attorney within the place of court, so that if you have fidgets, if your eye contact, what can cue jurors that you're nervous or anxious, being untruthful, what can make you a good gives you a good testimony. And I found that fascinating. And so I was very interested in whether it was arbitration, trial consulting, but the role of communication and finding solutions in complicated situations.
Okay, that is really interesting. Is that feels very different from what you do today? Do you see any kind of crossover from that part of your life to the work you're doing in home care?
All comes down to human communication, because human communication is everything, and it's singular intentionally because it's human. There's one form of human communication versus mass communications, which is plural. So human communication drives everything. When we work with people with disabilities, I'll just say people even with developmental disabilities, they could be nonverbal, but they may have multiple methods of communicating with you. And how you communicate is not just what you say, it's how you say it, it's how you deliver the message, and making sure you communicate intentionally and right with the people that we serve and the people business drives your outcomes.
Okay, well, great. Well, thanks so much for coming on the show. You've been in home care forever. What you built with Home Assist Health is really remarkable. But I don't have people on to talk about the stuff that went well. Instead, I have really successful people come on the show and talk about the big mistake they've made in their career and what that mistake taught them about life and about business. So, Sarah, what's your big mistake?
Big mistake. I want to start by being very honest. I describe myself as a organic growth entrepreneur, which is different than an acquisition or franchise entrepreneur. All very essential, just slightly different. I like to start things from the ground up. I like to create. I like to be involved with every element of it, the infrastructure, the culture, the ecosystem. And that's what also has led to one of my biggest mistakes, is because I had to stay close to everything early on. And that was necessary. But it becomes a liability at scale, right? Because it's founder over functioning. And at some point, you have to let go. And when you don't, that's when you cap capabilities, capacity, growth. And for me professionally, there were seasons where I had wonderful talent in my operation, but I was still involved with everything. And it created more of a culture of dependency rather than allowing these individuals to reach the top of their job description. I was making those quick fill in the gaps, make quick decisions rather than developing them as, you know, professionals that we needed for growth. And I've learned that I can't do that, because it did ultimately over time, you get burnout, get a little bit of resentment, whether it's inward facing or external facing. But I was capping not only my growth, their growth, but the company's growth and the overall intent. And it took me to understand the why behind that. And so with some, self-reflection, it's faster to do it myself. I know how things were set up. I've got the history. I can move fast. I can get it quick and I can get it done. And sometimes it gives you a sense of confidence and it fills your identity. Like, I can do it all. And you get a little bit of an ego on that. The third thing, so those were the two, right? And then the third is like, it's a little vulnerable. Like, what if somebody comes in and they can do it better? Or what if they find a mistake and I'm not perfect? And it requires some humility to say, it's not about being perfect. It's about building something that doesn't require you to be perfect. And you don't have to hold all the strings. You have to develop the team that can hold the strings for the organization. And so I still have to relearn that as we start up new programs. I mentioned that I see myself as an organic growth entrepreneur. We established our community health worker program in the state of Arizona. It never existed before. We got um, the voluntary licensure passed. We didn't pass it through the legislature, but it passed. But then what we did do is we steered the development of the programming and worked with Medicaid to establish the Medicaid funding model for home care agencies. And we worked with South Dakota to establish this payment model and the workforce. So I was very close to it. And then I had to bring on leadership and staff to carry it forward. And that separation is hard, constantly relearning it. But I have to, it's being self-aware and humble helps you with that. And now it goes from early stage, be the hero. Growth stage is create heroes amongst your team.
Was there a particular time in the business where you realized I'm still being the hero and that's holding us back?
Yes, that's what I'm constantly learning. When I took over and when I took this product out from the hospital system in 2014, we only had 2 contracts with MCOs. So we expanded to 3 contracts and then into DDD services, which is a 4th contract, into private pay, community health work, and community, and now home health. So each one, I would dive in deep to create them, but then I had to bring on staff to take them over. And if I did, I learned that I had to not only bring in the right staff, but I had to be able to back off and not interfere and have professional trust in them and develop and encourage them. Accountabilities always have to be there, but I'm constantly learning it. I don't think it'll be one that I check the box off and say I've finished.
Well, and I think that motion that you're doing, which is you're the person who can go in, learn the thing fast, move quicker than anybody else, figure it out, backfill the structure, have the program, but then you've got to go do other stuff. And if you're required, if you're the only person who can do the thing, the program's only going to grow so big. And so I think that continual motion of you have to be in the weeds, you have to micromanage the thing, it has to be your baby, but then it's got to be somebody else's baby because you've got to go, I guess, deliver another baby. It's a weird metaphor. Do you have a playbook, a plan for how you make that transition? Okay, now I realize I'm here and I've got to make the transition or else I'm going to stay and I'm going to be the bottleneck and all that. How do you find the first person you bring in? How do you delegate that responsibility? How do you know you've made a bad hire? Because that probably still happens from time to time. Talk me through that process.
So there's a lot of answers to that one because it's at different stages. In my very early stage of my first startup, I did everything. I did the payroll. I did everything. Staffing. I went and did the home visits, the assessments. I did everything. And it got to a point where I literally never had a day off. I had run payroll at 1:00 in the morning. It was 7 days a week. At that point, I didn't have children, so I was kind of running at my own speed. But it gets to a point where, we had children, we were establishing a family, and I needed to create that balance. So I started hiring staff, but I had to get the business at a volume to where I could afford the staff. Then I had to get to the staff, and then I needed to develop pathways for them to grow their own be a partner in growing the program so we can hire additional staff. And so creating those models of triggers. So I created, at what scale, at what volume, at revenue triggers can we bring in more staff and grow and expand and maybe go into other territories, all with the intention of, as much as possible, being self-funded. So currently we have no debt. We don't owe anybody any money. We've organically grown all our programs. We're self-funding our home health startup as we did our community health work startup. We do get grants that are reimbursing us for different services, but it's just looking at the metrics that tell you when, and then having those accountability controls within the team that you're bringing in. But I think the biggest thing for me to have learned, and I encourage others to learn who are in these leadership roles, is that humility. You have to know when you have to get out of the way. It's not about me being perfect and the all-knower. It's about me surrounding myself around people who might be better at something and celebrating their strength and bringing in these SMEs to do what I know we need to do better than myself and make sure that we're all working holistically together for the greater purpose.
I really appreciate you sharing that. I know like people who listen to this are going to really resonate, but like where we are at Zingage and kind of pretty rapidly growing the team, those are the questions that I have because I'm good at stuff, right? And kind of my thing is being really like good at stuff. And as I continue to bring in people who can devote 100% of their time to a thing and are maybe 80 or 90% as good as I am at the thing, but have so much more focus and specialization. Or when I bring on people who know more than me, I think that's the, like, what's the point of me if I've brought on somebody who can do the thing that I was doing like 50% well, if they can do it like 80% well.
And I look at that too, right? So it goes back to the saying of all boats must rise together. So if you bring in somebody who is much better at this segment of your business, better than you, that frees you up to get that much better in your role. Again, working towards the top of your job description and beyond. And that's where it's more liberating. It's like, okay, I can be free to do this because I'm not anchored down to this area that held me down because of my sense of identity that I created on this. I will say budget, right? Early on, I set the budget all by myself. I get to do the budget, pass it by the board, run the budget, brought in a person who was a professional in finance, and that was their job. And it was a little like, like that's the first thing, like, whoa, wait, hold on. But he's done an incredible job, and I'm staying out of the way. And he's now the fiscal steward for our organization, and he's doing incredible. So it's just recognizing the balance between not just your trigger points of when, for business health metrics, but also for your own check-in. Like, okay, when is this an ego identity thing? And you're capping out your own ability because you're anchored to this superficial notion of your value. And when you need to let it go. So not only will the company grow, but you're going to grow professionally too.
It's good stuff. Okay, I want to transition to talking about a couple of things, one that's overrated and one that's underrated. Which one do you want to talk about first?
They're related, so we'll start with overrated. I think in home care, and I'm going to lean more specifically to non-medical, Medicaid and private pay home care. I think it's overrated the amount of value we put into our default metrics. How many hours do you serve? What is your census? What's your gross margin? There hasn't been enough, and it's undervalued, I think, in the value metrics. And what is it that you've really done to impact your community? What are your fall rates? What are your emergency department utilization across your census? What's your hospitalization rate for your census? What's your satisfaction? What's your, all these other questions? What is the cost savings impact you had for not just your Medicaid beneficiaries in this health system, but your privately funded families? How much have you saved them money from alternative locations of care or mitigated, higher cost of care spaces like EDs? The healthy margins are incredibly important. So we need to know our margins, but they shouldn't define our value. What should define our value is the impact we're having in our communities and in the lives that we're touching. And it goes to a leader redefining what sits at the top of your dashboard. Is it just your gross margin? Is it just your census? Or is it these really outcome data points? Like looking at that, you still have to track the health of your business, but looking at maybe stability and continuity of care versus just how many hours of service you delivered. Maybe looking at the satisfaction of your employees versus how many employees do you have. Looking at your retention and longevity of those that you're serving and those that you employ, not just the static number of unique individuals. So those are things I think it would really come into is how we weight and celebrate successful agencies. And if we're not careful, and this kind of, I guess, blurs into another area, is we cannot fall into, we already kind of have as an industry, but it's so easy to fall into a commodity enterprise. And that's not what we are. It's not what we were designed and established to be. We are in the people business. And we're a value business. It's a commitment. It's not a commodity industry.
One of the things that I see in the market is there's always people trying to figure out how to do the like Uber for caregivers thing. And at some point, somebody is going to figure out how to build the staffing company in home care that can, if you need a person to come into your house and do some stuff, they will find that person to come into your house and do some stuff. And so I think the mandate for home care, like what you've just shared, is what are the additional value drivers that we're delivering, and how are we delivering value not just to like the individuals that we serve, but to like the other constituents in the healthcare ecosystem, to the payers and to the home health and hospice stakeholders and all that. And so I love what you've shared about the quality metrics, because that's the kind of thing that's going to continue to differentiate us over and against the just staffing organizations. Like, if you're not, what's the value that we're adding as an agency? Because if people just need a caregiver, there are other ways to find a caregiver than a home care agency.
100%. And we need to be efficient. But if we swing too heavily into efficiency, into just how do we optimize everything, and we swing too far away from the people, we're not able to effectively engage our workforce in a way that they're looking to be engaged. In this industry, these are caring professionals. We need to connect with their purpose. This doesn't mean we become a transactional industry. If we become a transactional industry, we're going to get into transactional workforce, not a compassionate, purpose-driven workforce. So we have to be careful, because if we're going to be effective and if we're going to have longevity as an industry, we have to stay rooted in the purpose of how home care even came to be, and stay that way actively throughout an employee's engagement with us. Again, you get too transactional, you're going to get transactional workforce. You're going to have them coming in and out, which is not cost efficient. You're not going to have quality care. You're going to have, fragmented experiences for the people that you're serving with. People just turnstile. It's transactional. And there's no value to that. It doesn't feel good. I mean, you don't want people just to come in and swoop out and leave. You want a relationship. That's one of the fundamental points we advocate, is the value that home care brings into your lives. And if we weight too heavily in just how efficient and optimized we are, and what our financial margins are, that doesn't drive value and outcomes. It's required to exist, but it shouldn't be what defines us.
Okay, perfect. Sarah, I want to transition to a part of the show where I ask you about a little mistake, because we talked about a big mistake that you made, but what's a little mistake that you see other home care owners make all the time? And if they quit, it'd make their lives or their businesses like 10 times better.
I think it's almost thematic to what we've talked about. I would see sometimes owners and operators are getting in their own way. They need to develop their team. They need to develop their staff, let them run with it, encourage them and strengthen them. Allow optimization and inefficiency, but don't lean too heavily in it that you lose the sense of your purpose. Sometimes we're so stressed and worried about reimbursements and funding, and if we can afford the next day, but that we're forgetting what really matters. So I would say, one, it's so easy to get in your own way as a leader, and it's so easy to worry about the finances that you lose your purpose.
I really like that. I think also one thing that strikes me is like tactically, I think there's some like ways to structure the week or the culture, or like the way that we meet together. And so what are some of the things that you guys like do as a team, maybe meetings, maybe like reporting, that help you to stay centered in like, what is your role and what is your team's role, and how do you make sure you're not the bottleneck and all of that?
We really get around data-driven decision making. So that gives us facts, right? Not bias, not, the single truth is a number, the data point. So we do individual performance dashboards monthly with our team members. We have department dashboards, and we have corporate reports, and they all roll up to a higher level that should align with our strategic plan. And when you can see that your data points are all in alignment and they're going in the direction you want, you find peace and rest in that, and you don't have to feel so uptight and worried. So if I know our target was to be at 100% and we're at 95%, and prior period we were 90%, we're in the right direction. So as long as we keep moving. So I find that using data, it also allows you to help hold team members accountable. It gives you a sense of peace and ability to let go of things that otherwise you don't have that framework to have confidence to let go. So metrics are essential, not just to identify and celebrate. We've used performance dashboards to provide incentives. So if we have our care supervisors that are achieving great outcomes, and those include not just volume of hours, but great success stories that they can share about the people they served, that can then trigger an incentive or a bonus that they earn. Because again, it's rewarding the great work, but it's having that. And if somebody's underperforming, when do you need to get in and do some coaching and education?
Yeah. I like the reporting, the numbers, the quantitative metrics also have like a qualitative element of like it's hard to measure the impact of a good success story, but like we know that it means important stuff for the business and the brand and the community.
Yes. And we've included things like teamwork. So somebody might get the manager who scored the dashboard might identify that somebody jumped in and backed up another employee because they were out or they picked up extra shifts or whatever. They participated in a team builder. So it could be something like that. But we've also had wonderful testimonials where somebody went out and was able to use their CPR successfully in a member incident. And our training and education team got celebrated, right? Because they did a good job teaching the skill. So they could be really big stories, but they could also be everyday stories.
Yeah, that's good. Okay, because we kind of wind up, we've talked about a lot of mistakes and things that went wrong, but I like to end every episode on a high note. So tell me about something that's happened lately in your business that you're really proud of.
The biggest thing is we just got CHAP accredited. We're very excited. We got our gold seal and we're just waiting on that PTAN and then we'll be able to start billing for Medicare services. So
Oh, that's awesome.
very excited. So that CHAP accreditation seal is all over our office.
Yeah. Tell me, because I'm always curious about the home health side of things and how it interacts with home care. Tell me a little bit about how you see the home health agency and the home care agency working together as you kind of build out that second service line.
So we have, it would technically be a third because we also have a community health worker agency, which is within our organization. They all work together very closely. So if we have somebody who's on our home care services and it's identified that they have a need, it goes into a referral for home health and they would reach out for, an eval. Same thing with our community health work services. Many times we might have somebody that might need assistance from a home health, whether it's a nursing visit or otherwise. And it goes a referral through our own operation. We're looking at this as a one-stop shop for the people that we serve. We're doing Medicaid home health, not just Medicare home health. So private pay might be more on the Medicare home health, and our Medicaid HCBS might be more of the Medicaid home health. So slightly different populations, but same services.
Well, before we get out of here today, what do you want to plug?
Oh my gosh. Zingage and the podcast.
Great.
I just think
we'll take it.
It's a great platform to learn, grow, and improve your business.
Well, Sara, thanks so much for joining the show. Really appreciated it. On behalf of the team here at Zingage, thanks for listening to the show. We'll be back next week with another episode, so be sure to subscribe wherever you listen to podcasts on Spotify or Apple or YouTube. Leave us a rating while you're there. It helps other people find the show. If you have comments on the show, drop me a line, david@zingage.com. Would love to hear from you, chat with you there.